So in the first couple days after a knee replacement, you're going to have a lot going on and a lot to deal with. But to help you see the forest from the trees, focus on 3 main things. Those 3 things are looking out for any complications. Those 2 complications are mostly blood clots and an infection. Low chance, but they do happen. Number 2, manage your pain and swelling. These 2 go hand in hand. Typically, the more swollen a joint is, the more pain that you're going to have. So managing pain and swelling is crucial to helping you get a good night's rest and recover. And then number 3 is maximizing your range of motion. So by that, you want to be able to straighten your leg all the way out, and then also achieving at least 90 degrees of knee flexion. Now, here's where I differ from a lot of other physical therapists. Many PTs, in my opinion, push too much. They're trying to get to 105, 110 degrees of knee flexion in the first 2 weeks. Now, if that happens, great. But as long as you're between 90 and 100 degrees of knee flexion, in those first 10 to 14 days, and you can get there and you can stay there. You do not need to push ultra hard. That range of motion will come as some of the swelling goes down, as you're able to tolerate a little bit more exercise. You will get there. The main thing is getting to 90, staying there, and then the remaining range of motion will come.